Okay, so what are some of the common anti-inflammatories? Well, right here, steroids. Steroids are one of the most commonly prescribed medications to treat inflammation in patients, but one of the side effects of steroids is bone loss. Now, how? Why do steroids cause bone loss? Because steroids reduce calcium, magnesium, vitamin C, vitamin D, and zinc, just as for starters, right? And these critical 5 nutrients play a major role in how your body repairs bone and how your body maintains bone. So steroids also work catabolically. The catabolically means they break down tissue. So steroids are catabolic in nature. That means your tissue gets broken down. This includes bone, but it also includes muscle. That's why people that go on long-term steroids end up getting super swollen. They retain a lot of water, but their muscles just waste away and they lose most of their strength. And the longer they're on those steroids, the greater the risk for the development of that bone loss. And this is also true. It's not just true people that take oral steroids for pain. It's also true of those of you with asthma and you're trying to reduce your asthma inflammation as a result of that inhaler, that steroid inhaler. So be aware that that correlation exists. Okay, so let's talk about nutrients. I said earlier that, bone loss is not a calcium deficiency. So Ca, this is calcium. Okay, this is an example of some of the most common and important nutrients that play a role in building and maintaining your bone. Now, this is not a comprehensive list. This class is not designed to go into the hours and hours and hours of conversation that we would have to have about how all of the nutrients play a role in bone health. So please, you may have a nutrient in mind that's not on this list. I just want you to know this is not intended to be the most comprehensive list. There are other nutrients as well. That being said, these are some of the most critical and some of the most important. So calcium, magnesium, vitamin B9 and B12. Okay, why? B9 and B12 deficiency lead to an increased homocysteine level. So this is another test you can ask your doctor to run. Increased homocysteine has been linked to bone loss. And how can we lower homocysteine? Well, predominantly B12, but also folate, which is vitamin B9. And so that's where that connection exists. We also have drugs, or not drugs, but nutrients like vitamin K. Vitamin K helps to push calcium into your bone cells. So think of vitamin K as the air traffic controller for calcium. It makes sure that calcium makes it into the bone matrix. And then we have nutrients like vitamin D. As I mentioned earlier, vitamin D tells your intestinal cells to absorb calcium. And so if you don't have adequate vitamin D, your intestinal cells will not absorb calcium super efficiently and you can become calcium deficient. So vitamin D, very important along that line. We also have vitamin C. Now vitamin C, very important for forming the collagen. Your bone is made out of a few different things. It's made out of an organic latticed network of collagen and protein, and it's made out of a network of minerals. So you have this basis backbone of protein, and then minerals come in and harden it and mineralize it. And so vitamin C is very, very important for the formation and the strength and the integrity of the collagen in your bone. Then we have protein. Protein, very critical. Protein forms that backbone matrix of the bone itself. We'll talk more about that in a minute. And you've got iron and zinc, and then there's potassium. So again, you've got vitamin K here, and then here we got potassium is represented by a K. And then boron, selenium, and strontium being minerals. Now I want to show you just a little bit of the research on nutrition and bone. So let's take a look first here at magnesium. Okay, so this is just a review on the importance of magnesium in bone health. And so a review of multiple studies. You can see here lower values of magnesium are related to the presence of osteoporosis, and that about 30 to 40% of the subjects analyzed, mainly menopausal women, have hypomagnesemia. Considering the intervention studies published to date on supplementation with magnesium, most have used this mineral in the form of citrate, carbonate, or oxide with a dosage varying between 250 and 1800 milligrams. In all studies, there was a benefit in both terms of bone mineral density and fracture risk. So improvements both in the bone itself, but also a reduction in the risk of fracture. Magnesium, super important, and research confirms that in a big way. Then we have, let's see here, let's pull this one up. This one's on the role of zinc in bone health. And I think important to understand, a number of studies have been done on zinc, but this was a paper that was published kind of analyzing all of them and the functions of zinc in bone health. And so you can see here in this diagram, on the left-hand side, you've got insufficient zinc, and then on the right-hand side, you've got adequate zinc. And what happens is the lower your zinc goes, the poorer your bone quality gets, the slower your bone regeneration gets, and the slower your bone growth gets. So we have 3 different parameters being affected as a result of not having adequate zinc. So we know zinc plays a major role in all 3 of these areas and going to be a very important nutrient for bone health. Now, so many individuals are low in zinc because they're taking medications that deplete zinc. Probably arguably one of the biggest ones are your blood pressure medications. So a lot of folks out there with high blood pressure issues taking these types of medications really struggling. Now this next one on protein, and I mentioned this earlier, but again, there's this major attack on protein right now. We are being told that eating animal protein causes all kinds of nefarious health problems and diseases. We're being told that it destroys the planet. And yet, on the other side, we're being told to eat all these processed junk foods that are full of very harmful ingredients and untested ingredients, like a lot of these plant-based meat substitutes that are coming out that have become more and more popular. But the reality is most people are protein deficient, and most people eat way too many carbohydrates and don't eat anywhere near enough protein. And all the research has been coming out here recently saying this. This is especially true of people as they get older. Women, especially over the age of 60, should be eating 1.2 to 1.5 grams of protein per kilogram of body weight. Okay, so if you want to get your kilograms, you just divide pounds, or you take your weight in pounds and you divide that by 2.2, and that should give you your weight in kilograms. So you can do the math, or you can go to Google and you can search and do a calculator. But 1.2 to 1.5 grams of protein per kilogram of body weight, and most people and most doctors are recommending 0.6 to 0.8 grams of protein per kilogram of body weight. It was not even, in some cases, not even half of what you need, right? So protein becomes a very important nutrient. And if we're talking about the research on protein, and this is a major summary, a systematic review and meta-analysis of protein intake and bone density, you can see that dietary protein, adequate dietary protein, leads to improvements in hip and femoral neck bone density. Inadequate protein increases the risk for hip fracture and reduces bone density by as much as 11%. I mean, these are huge changes. So think about this. How many of you have gone to your doctor and you've been diagnosed with osteoporosis from a bone scan, and instead of saying, hey, I need you to be here, we need you to be here, 1.2 to 1.5 grams of protein because your bone is made of a base of protein, but how many of them instead pull out the prescription pad and write you a prescription for something like Prolia or Fosamax, right? These very potentially dangerous drugs. We'll talk about that shortly. Stay with me. But protein, so important and so easy to eat, so easy to add to the diet, but so many have been misled by so many, we'll just say, untrained or uneducated doctors as it relates to nutrition. They're following along the same lines of rhetoric that the media is pumping out to make everybody protein malnourished. It's in my opinion, it's a little ridiculous. Okay, so that's protein. Let's talk about strontium. Strontium is interesting. So it's a mineral, and it's actually in Europe, it's used, there's a certain kind of prescription strontium used as a drug treatment. But you can take natural strontium. You don't have to use a medication. Those of you listening from Europe, you can take, instead of the medicine, you can take strontium citrate, which is a natural supplement. But one of the things I want to point out here is that commercial foods grown on fields using synthetic fertilizers, pesticides, and herbicides have appreciable lower levels of strontium than organic food counterparts. Now, you always hear me say eat well, eat organic. There are reasons why we want to choose organic. One of the biggest is that it's more nutritionally dense than non-organic food. So you get these minerals in good organic food choices. You can see here, that's the restoration of adequate strontium levels to individuals may simply represent the normal homeostatic requirements for strontium, and normal healthy bone may require some levels of strontium to prevent calcium loss. If strontium helps your bone preserve calcium, most importantly, treatment to elevated strontium levels has repeatedly been shown to demonstrate safe and remarkable efficacy at diminishing fractures in hip, vertebral, as well as peripheral sites. So strontium, which is one you very rarely hear anything about at all, is very critical as a trace mineral to improve and to support bone health. Okay, let's talk next about iron, because this is a really common one. I've talked about this a lot in context of celiac disease, meaning this is iron deficiency is #1 deficiency in people with celiac and gluten sensitivity. And this is, this is not just me saying this is my experience clinically, but it's also what you'll see if you do a literature search on nutritional deficiencies and gluten sensitivity, as iron is a super common deficiency. Now there's a kind of a balance with iron, and this is a review of that balance, where too little iron can contribute to poor bone formation, but too much iron can also create to poor bone formation. So you can see your iron overload leads to an increased breakdown of bone, okay, but adequate iron also leads to improvement in bone quality. So it's just like anything else. Too much, not a good thing. Too little, not a good thing. We have to hit that right amount. So if you've been diagnosed with bone loss and your doctor's not measuring your iron, he should be. And a lot of doctors will not do an iron panel, but you ask for an iron panel as a starting place, right? An iron panel is at least more accurate, or at least more representative of iron than just running, because a lot of times they'll do a CBC and they'll give you hemoglobin and hematocrit. These are two markers that can mean you have an iron deficiency. But you want an iron panel. You also would ask your doctor to measure ferritin, which is stored iron. Those are kind of bare bones testing just to look at iron status. And so again, if you're low, which is super common in those with gluten issues, we see ferritin very commonly below 10 in folks. We see iron, stripped to the floor. We see chronic recurring anemias, people that, that no matter how much infusion they do, no matter how much iron they try to take, their iron levels keep dropping repetitively. And this is going to impact and affect the bones. So just be aware of that, and get it measured. These are all things that can be measured. And if your doctor wants to put you on, a very powerful drug, they should be measuring your nutrition first. Always measure nutrition first, because the answer to your problem might be in nutritional supplementation and not necessarily in chemical manipulation with medication. Okay. So let's rearrange this, because these are both coming from the same research study, and I just want to give you a couple of summaries on it. So if you look here at, this was actually a study published a number of years ago called the COMB study. COMB stands for, it's an acronym, doctors love acronyms, a combination of micronutrients for bone. Okay, so a combination of micronutrients for bone. In this particular study, you can see here patients who declined using pharmacotherapy, meaning patients that did not want to take bone drugs, or who previously experienced failure of drug treatment, meaning they took the drugs but the drugs didn't work, were offered other options, including supplemental micronutrients identified in the medical literature as sometimes having a positive impact on bone mineral density. After 12 months, this was a 12-month study, after 12 months of consecutive supplementation micronutrient therapy with a combination that included, these were the things that were included, vitamin D, vitamin K2, strontium, which we just talked about, magnesium, and DHA, docosahexaenoic acid. By the way, docosahexaenoic acid, this is a type, let me write that a little neater. This is a type of omega-3 fatty acid. So if you're eating cold water fish, that's a good source of DHA. But in this, again, in this study, vitamin D, vitamin K, strontium, magnesium, and DHA, and then they repeated their bone scans. The results were analyzed in a group of compliant patients and demonstrate improved bone mineral density in patients classified with normal osteopenic or osteoporotic bone density. According to the results, this combined micronutrient supplementation regimen appears to be at least as effective as bisphosphonates, that's drugs like Fosamax, or strontium ranelate, which is the prescription strontium used in Europe, in raising bone mineral density levels in the hip, spine, and femoral neck sites. No fractures occurred in the group taking the micronutrient protocol. This micronutrient regimen also appears to show efficacy in individuals where bisphosphonate therapy was previously unsuccessful in maintaining or raising bone mineral density. Again, this just is a reiteration that nutrition is far more important than chemical manipulation. This study shows it. Now, we look at the mechanism of action of micronutrients. You can see micronutrient strategies do not work by altering physiological parameters such as the function of osteoclast. So the osteoclast, remember, is a cell that breaks bone down. That's how bone drugs work. So micronutrients don't work that way, right? They rather work by function, by remediating underlying nutritional deficiencies, which then permit restoration of inherent physiological processes. It is increasingly documented that nutritional deficiency continues to be an unrecognized and undertreated problem in clinical practice. In my opinion, it is the #1 problem in our healthcare society today. Is nutrition is totally ignored by most doctors, and not only is it ignored, it's ridiculed in many cases, and patients are gaslighted and told it has nothing to do with fill-in-the-blank condition, and that's true of bone loss. Investigations and management of malnutrition, often found in those with chronic disease, should become standard practice in clinical medicine. So in essence, the authors of this study feel like malnutrition and correcting nutritional deficiencies should be the standard of care, not the other way around, not using drugs first and then come around to nutrition if drugs fail. Now, if you look at the relative cost, this is where it gets really interesting. So if you look at the current COMB protocol, which is the combination of those different nutrients, costs about $2.26 a day, okay, amounting to $67 or so a month, or $824 a year. Now, I would argue that if you ate well, you would get a lot of these nutrients that you're supplementing with. Eating organic, eating real food, right, as opposed to junk food that's high in calories and low in nutrients. And so it wouldn't really cost you any more. It would just cost you the cost of the food that you're already buying, but you may spend a little bit more on buying high quality food, but the quality of life that you'll have as a result of it, in my opinion, is worth the cost. Now, then we get, if you're using bone drugs, so bisphosphonates, this is, again, there's a range in cost, okay, from 90 cents a day, that's the least generic preparation, to up to $12.96 per day for the brand name versions. Now, they mention this generic preparation. Let's just make a note about generic preparations. It's a really good book. I recommend that you all check out. You can listen to it on Audible if you do audiobooks. You can buy it and read it if you prefer to read, but it's called Bottle of Lies. And what this book is about is it's about generic drugs. A lot of our generic drugs today are produced in India and China, and the oversight, the FDA oversight on these particular medications is horrific. There are FDA inspectors that go over to these factories that are producing these generic brands, and they're coming back to the FDA and saying, these guys are doing a terrible job, their facilities aren't clean, they don't have any standards. And the FDA is turning a blind eye to it. And that's what this book is about. It's about exposing that. And so if you're on a generic preparation, look, I think it was Mayo Clinic a number of years ago quit using generics because they were getting such inconsistent results in trying to manage their patients' health. And so they've gone predominantly to brand name drugs. So now, again, if generic is not all that trustworthy, here we have to go to the brand name. And so now you're talking about $2 a day versus $12 or almost $13 a day in terms of cost difference, but the impact or effect is no different, meaning the nutrients work better without the side effects, according to research. And then you can get there are of course other ones that you can go down to $5.58 per day for alendronate, which is another type of bisphosphonate. But again, it's still not cheaper than that $2.26 a day of nutrients. So very important that you consider nutrition if you've been diagnosed with bone loss, and because otherwise, what's the alternative? The alternative is to use bone medications that cost more, and not just financially. And let's talk about that for just a second here. Okay, so this diagram here is a list of some of the most commonly used medicines for treatment of osteoporosis. Okay, so you can see here the category on the far left, and then the names of the different types of medicines here, and then we get how they actually work, and then their side effects. And this is really what I want to pay attention to. Bisphosphonates, again, common examples. One of the major side effects that I have seen very frequently is esophageal erosion, meaning people get on these drugs and it just tears up their esophagus and their stomach. Now, the problem with that is it causes malnutrition. When you can't eat, it hurts to eat, and you're destroying the lining of your stomach and your esophagus, you're going to cause malnutrition. But we also know that the side effects of these medicines can cause bone, joint, and muscle pain, intense muscle pain. Look, the number one thing you can do to prevent bone loss is exercise. Now, what you're not going to be able to do if you're taking a medicine that causes you to have a lot of pain is exercise. So by default, the side effect profile can contribute to the bone loss that you're trying to treat. Now, we also know one of the other major side effects is bone death. That's what osteoporosis means. It means bone death. And this is, in this case, of the jaw. And this is a manifestation of long-term use of this type of medication. That this is a lot of dentists will pick up on this because, they'll have patients that come in with a lot of bone pain and jaw pain and dental problems. And then additionally, atrial fibrillation. So if you're going to your heart doctor after you've started a bone medication, know that this class of medicines can do that, and just be aware of it. Now, you can also know that, so these are side effects, but then these are problems of exposed long-term use. So if you're on them for any great length of time, we know that these drugs increase the risk of cancer of the esophagus. They also increase bone brittleness and increase the risk of certain types of femur fractures. So the whole goal here is to reduce the risk of bone loss, but these particular medicines can increase brittleness of the bone. And this happens to do with what these drugs do is they force calcium into the bone in an overabundant way. And so, your bone needs a little, just like anything else, your bone needs a little calcium, but it doesn't need more than what it needs. And if you put too much mineral in the bone, then the bone becomes too brittle, right? Remember, bone is supposed to be pliable. It's supposed to have really great tensile strength. It's not supposed to be hard like steel. It's supposed to be more like bamboo, where if you were to bend it, it bounces back and it doesn't snap, it doesn't crack. You bend steel hard enough and it snaps. We don't want your bone to do that, and that's what these drugs can do long term. Then we have other drugs, a little less commonly used, but Avista, raloxifene, which is a selective estrogen drug. This particular class of medications can cause blood clots in the veins, in the eyes, in the lungs. We got a typo here. In lungs, strokes, hot flashes in the legs, or leg cramps, rather, leg swelling, shortness of breath, and vision changes. And in long term, increases the risk of thromboembolism and fatal stroke. So, risk benefit, guys and gals. That's what taking medicine is all about. Is the risk of the side effect of that medication worth the benefit that the medicine might provide? And that's only a question that you can answer. Don't let anybody force your mind on any of this. And then there are the biologics. These are kind of relatively newer, but Forteo and Prolia, these are common biologics now being used. These are more of the injectable types, where you got to go to your doctor and they inject you with these drugs. And they're parathyroid mimicking type hormones, basically. But what they do is they inhibit maturation of the cells that break bone down. So they stump or stop the maturation of the specialized bone breaking cells. Now, side effects: nausea, vomiting, constipation, low energy, muscle weakness. Again, muscle weakness. We're talking about exercise, okay? And then we come over here to joint aches, leg cramps, dizziness, and increased blood calcium. So they increase the quantity of calcium in the blood, and that can increase the risk for cardiovascular events. Low blood calcium levels as well can sometimes happen. So serious urinary and respiratory tract infection, skin rashes or inflammation of the joint, pain, and osteonecrosis of the jaw. And then we have long-term risks: osteosarcoma, and that's cancer of the bone. So, these are the risk-benefit ratios that you're embarking on if you take this direction first.